When it comes to emergency services, I think one of the unique things that we see is that actually they are under-reporting, under-calling, and themselves don't know. I often speak about a South Africa which is unaware of how traumatized it is, actually, because it becomes so daily, such a part of our water cooler talk, our bride talk, our everyday in transit conversation, that there is no awareness that actually we are in real trouble. Emergency services personnel the world over, we know through studies, would struggle to even know that actually they're experiencing trauma day and have to push it away and dissociate and pretend that it's not there or avoid in order to keep going. In South Africa, that is compounded exponentially because of the lack of resources that they have within their services. So they oftentimes are overworked and stretched, so there isn't even an opportunity to debrief properly, and they are getting more and more exposed through the frequency of traumas that they have to attend to. And then on top of that, there aren't sufficient services, both in terms of the numbers as well as potentially the quality, to deal with what it is that they're going through. So they are really, really struggling and suffering. And in fact, we wish that we would get more calls from emergency services as an immediate response. And then of course, at a particular time, we would like to see some sort of absolute intervention as well. So I mean, I think that that they're struggling to this extent. It is an absolute crisis, and I think that we need to be unequivocal about that. In fact, we need to be emphatic in saying that something has gone horribly, horribly wrong, and we can imagine some of the reasons why it's gone horribly wrong. I think that they are a vulnerable population, actually, because they attend to a vulnerable population, and there isn't a system, like a bigger structure, that is treating them like that and responding to their vulnerability adequately. I think mental health or mental wellness is also something that is hugely neglected, denied, and overlooked. So their wellness oftentimes will be thought about in terms of their physical wellness. Do they have protective gear? Which apparently here they're also struggling, actually, even with that. Let alone to the fact that, do they have internal protective gear? Kind of going into trauma situations, when they're in trauma situations, coming out of them, and then leading normal lives. It obviously then paints a picture of the fact that there are structures internally which are not responding in a way that they should be to this population and their absolute needs, that they're having to dig out of their own pocket to try and get some help and assistance. I mean, I suppose at this point I want to add something else, which is that you refer to emergency service personnel, to policemen and to doctors, and ordinarily these are people who are helping people, and it becomes very easy to think that they too need help, as opposed to us as a state really kind of having a bit of perhaps a Russian doll kind of a way of working, where you help the helper all the time, and those who are going out there to provide such services themselves have something to contain them, or something to really, really help them, and in fact then they'll do the job better. Besides the fact that they'll be generally better human beings because they will have their internal world treated, their responses will be a lot better. So it is to some extent, and not the full story, though it is to some extent then not a surprise that we have a situation where a lot of people in the policing service, and a lot of people in the hospital services, and a lot of people who are first responders or first responder people are brutal, or at the best of times lack empathy, or are impatient or frustrated. That is symptomatic. I doubt that a lot of those people would have chosen to go into a helping profession if they didn't really want to help. Though when there is a system or a state that does not recognize that they too need help, it can frustrate them to the point where they do all sorts of really horrible things. And I really do not believe that was the absolute motivation or intention to begin with. So I think that government really kind of needs to recognize the importance of helping the helper in this regard, especially when you're speaking about these kind of 3 and more populations, because there can be dire consequences to that. To put it very simply, you can imagine that a neglected person will be neglectful.